Do y'all know what time it is? I said, do you know what time it is? It's time for KP's Video News. That's right, KP's Video News. KP's Video News. KP's Video News. KP's Video News. That's right, it's time for KP's Video News, y'all. And I'm telling you, this whole thing is information. More and more information is coming out daily about how things are being handled here with this C virus in the United States. And this story I just found pertaining to Nebraska getting $300,000 in federal money for each coronavirus case, while New York, the state that's getting hit the hardest in the United States, is getting, listen, $12,000 per patient. Go figure. You know, $300,000 in Nebraska, where they have a low, extremely low number of cases, but the place that has the highest number of cases in the nation is only getting $12,000. So probably few hospital systems need emergency federal grants announced this week to handle the coronavirus crisis as badly as Florida Jackson Health does. In Miami, its operations is the worst COVID-19 hotspots in one of the most severely hit states. Even in normal years, the system sometimes barely makes money. At least 2 of the staff members have died of the virus. And don't forget that I'm talking, that was Florida I'm talking about right there. In Florida, remember, about 2 weeks ago, the Florida governor of Florida was like, "Oh no, I'm not going to close. I'm not going to make people go stay at home. I'm just, I'm not going to enforce that. This whole virus thing is a hoax. Blah blah blah." Now they're being hit hard, and it's another mysterious thing that they're being hit hard in those minority heavily populated cities like Miami. But in a scathing letter to policymakers, Systems CEO Carlos Mayorga said the way Washington has handled the bailout could jeopardize the very existence of Jackson, one of the nation's largest public health systems and similar hospital groups. "We are here for you right now," Mayorga, who has tested positive for the coronavirus himself, said on Thursday in a letter to Alex Azar, Secretary of Health and Human Services. "Please be here for us right now." Mayorga and executives at other beleaguered systems are blasting the government's decision to take a one-size-fits-all approach to distributing the first $30 billion in emergency grants. HHS confirmed Friday it would give hospitals and doctors money according to their historical last year revenue from Medicare programs for seniors, not according to their coronavirus burden. That method is woefully insufficient to address the financial challenges facing hospitals at this time, especially those located in hotspot areas such as New York City region. Kenneth Rath, CEO of the Greater New York Hospital Association, said in a memo to the association's members. States such as Minnesota, Nebraska, and Montana, which the pandemic has touched relatively lightly, are getting more than $300,000 per case in the $30 billion, according to the Kaiser Health News analysis. On the other hand, New York, the worst hit state, could receive only $12,000 per case. Florida is getting $132,000 per case. KHN relied on an analysis by staff of House Ways and Means Committee, along with the COVID-19 cases tabulated by the New York Times. The CARES Act, the emergency law passed last month to address the pandemic, gives HHS wide latitude to administer $100 billion in grants to hospitals and doctors. But the decision to allocate the first $30 million, according to past medical business, surprised many observers. The law says the $100 billion is intended to prevent, prepare, and for respond to coronavirus, including paying for protective equipment, testing supplies, extra employees in temporary shelters, and other measures ahead of an expected surge in cases. Its hospitals must apply for the money. It seems weird that they wouldn't just target areas geographically based on where the surge has been. Issuing the funds based on Medicare revenue allowed us to make initial payments to providers as quickly as possible. This is the HHS propaganda stated on Friday. Some of the money was expected to go out as soon as Friday in electronic deposits. HHS has failed to consider congressional intent in distributing $30 billion by not accounting for the number of COVID-19 cases hospitals are treating. New Jersey Senator Bob Mendez and Cory Booker and Representative Bill Pascrell said Friday in a letter to the Azar. All three are Democrats. Behind New York, New Jersey has the second highest. Behind New York, New Jersey has the second highest number of recorded coronavirus cases as of Friday afternoon, as of today. So New Jersey's number 2 now, behind New York. The administrator is struggling to balance the need to help systems slammed by the coronavirus with need to provide immediate relief, said Bill Horton, a health care lawyer in Birmingham, Alabama. Providers have to appreciate that there is a focus on trying to respond to their cries of pain and coming up with ways to get some money out there. He said, on the other hand, he said HHS sets itself up for criticism by paying a chunk of money without particular regard for who has been hit the hardest. Medicare revenue can vary sharply by hospital depending on who their patients are and what part of the country they are in. HHS method could tilt the playing field against hospitals whose patients are largely uninsured or covered by the Medicaid program for low-income patients, said Bruce Siegel, CEO of America's Essential Hospitals, a group of systems serving the poor and vulnerable. Sidebar. Okay, now yesterday I did a story on the extremely large numbers of minorities that are dying in places like Chicago and Chicago and New York and Detroit and New Orleans, and to read that story, to read that particular paragraph once again. Listen to what I'm saying. The HHS method could tilt the playing field against hospitals whose patients are largely uninsured or covered by the Medicare program for low-income patients, and hospitals, a group of systems serving the poor and the vulnerable. So now you know why so many minorities are dying, because the government is sending money to places like Nebraska that have hardly no cases, $300,000 per person, and they're only sending $12,000 per person to a place like New York that needs the money. So this thing is totally ridiculous. It's totally ridiculous. We cut off our own funding sources in order to sustain our missions. Hospitals in relatively COVID-free areas, on the other hand, could continue elective procedures but still receive a big chunk of the $30 billion. If I'm in rural Kansas and I don't have any COVID patients in my area, I should not stop doing elective surgery. So elective surgeries, those are surgeries that really don't need to be done, and they don't really need to be covered at this particular time. Sad. Do y'all know what time it is? In New York, 39% of beneficiaries are in Medicare Advantage, and 39% are in Medicare Advantage in New York. In Montana, by contrast, the figure is 17%. In Wyoming, it's 3%. So it's a real disproportionate amount of finances being sent to the places that need it and the places that don't need it, concerning the number of cases that are being treated in this United States. And hey, this is a bad time for everybody, and we really got to wake up and realize that the present administration that's in office right now, they're doing a terrible job, and they need to go. They need to be replaced as soon as possible. If people are gonna, if you wanna, it's time to revisit that impeachment thing. Go back for impeachment trial number 2. Get him out of there.
Video News. That's right. KP's Video News.
Peace, folks. Peace.
KP's Video News.